next speaker, Professor Jeffrey Siegel, next, and then I'll just let him speak before I introduce you to Dr. Stefan Bilodeau and Dr. Simon Smith. Professor Siegel has to pull away. He's actually chairing an ASHRAE meeting. So I just want, for the sake of time. So Professor Jeffrey Siegel is a professor at civil engineering at the University of Toronto and a member of university's Building Engineering Research Group. He is internationally recognized for his work on indoor air quality and air cleaning specifically, and is a fellow of the American Society of Heating, Refrigeration and Air Conditioning Engineers, ASHRAE, and a member of the Academy of Fellows of Society for Indoor Air and Climate, ISIAC. He has published over 100 peer-reviewed articles on indoor air quality and related subjects, and has been active in disseminating information on air filtration and ventilation solutions. There's been a lot of discussion around air purifiers, and as always, you know, at OCAO, we really want to go to expert sources for you know, to get good information around the questions. So I would just like to thank Professor Siegel for offering to present, and welcome Professor Siegel. Thank you.
Thank you very much for the introduction and the invitation to speak here. What I want to do for the next 15 minutes or so is kind of talk about what filtration and air cleaning mean in the circumstance we find ourselves in now. And if you have looked at the air filtration and the air cleaning space, I think it's appropriate to describe it as a jungle. There's all kinds of different claims, all kinds of different technologies, and it's very hard for building owners, for consumers, to be able to kind of separate what works and what doesn't. And so that's really the goal of today. So if I think about this jungle and kind of how do we start to make some sense of it, there are a few points I want to make today. The first one is that even the technologies that work, and even if they're done well, they're not silver bullets, they're not magic. They're part of a more comprehensive strategy. And specifically, if you want to make an air cleaner or a filter work, you have to understand the context in which it's used and make sure that you're using it well. And then throughout the presentation, I want to talk about what the actual evidence is of benefit of these technologies, and also point out that there are some technologies for which we don't yet have good evidence that they're going to be helpful for us. So the analogy that I always come back to, and I wish I had thought of this, but of course did not, this is a very old theory, is that we have many layers of protection against respiratory viruses and this virus in particular. And none of those methods are perfect. They all have holes in them. And so our goal here is to have as many layers as possible so that those holes don't line up and we don't have transmission. And I'll say right at the beginning that close contact that Raymond talked about, filters do not protect against that type of transmission. And, you know, by extension, filters, nothing I'm going to talk about today, even if it works, is a replacement for all the other measures, the kind of primary measures, mask wearing, physical distancing, maybe surface cleaning. We have to do all those things first, and then we use filters as one more strategy to help protect us. So the appropriate starting point here is, you know, can filtration even remove viruses, and this virus specifically? And there's a lot of questions. Isn't it too small? Don't the large droplets settle quickly? Is this airborne? Can it be transmitted long ranges? And we just heard a lot about that. And so the answer is, you know, filtration can work. But I want to point you to something. This is something I just added to the presentation as Raymond was speaking. This is from a recent paper where we went and got a whole bunch of filters from homes in Toronto, and we sucked the dust off of them, and then we sized that dust. And the reason I wanted to show you this picture is that the median particle size, the height, the place where that peak is the highest, is about 30 microns. That means that even a giant particle, a 30 micron particle, can make it all the way through the distribution system to a filter. And this should jibe with your personal experience. If you've ever changed the filter in your life, you'll notice that it's covered with very large particles, so big that you can see them. So, you know, filters can remove these particles, and the large particles can travel long distances indoors. But even more so, if we look in the literature, there's several examples, 3 or 4 of them quoted here, of where people have taken filters out of buildings, or in one case out of aircraft, and looked for different viruses. And they were able to find virus on all of these filters. And, you know, there's no measurement here in any of these cases whether the virus was still able to cause infection. But the bigger point here is that filters can remove viruses. And the bottom paper here, which is a preprint, it's still in review from a group in Oregon in the US, they found in a hospital that was treating a small number of COVID-19 patients, they found the virus on both pre-filters and final filters in this hospital. Again, indicating that some of this viral material is making it and being removed by filters. Now, having said that, just because a filter can remove it can remove a virus, it doesn't mean that it does remove a virus. So there are kind of 3 ways I like to compartmentalize the problem, this kind of issue of context. One is you have to get whatever you're trying to remove, in this case, the virus, to the filter or the air cleaner. Then that filter or air cleaner has to actually remove the virus. And the overall removal has to be important in the space. And so I kind of break those down into 3 big picture issues: airflow, installed or in situ efficiency, and effectiveness. And I'm going to talk about each of those. So the first question is, does air go through the filter? And first, there's a question of air flow rate. I'm not going to show you lots of data here, but let me just point out that airflow rate varies hugely. Some filters have a lot of airflow, some filters have very little airflow. And so the first thing to make an effective filter is to make sure that there's a lot of airflow going through the filter. The second thing is something that I call runtime, but you can think about this as what fraction of the time is the system operating. In many, even most residential buildings with forced air systems, as well as in some types of commercial systems, the system only runs when the thermostat calls for heating or cooling. And if you look at the graph that's here, first 7,000 homes in North America. Each dot represents a month of operation, with the mean outdoor temperature on the y-axis and how often the system ran on the x-axis. And you can see there's a lot of scatter in the data, which is typical. There's a lot of variation between buildings. But the point I want to point out here is that red dashed line. That's the median runtime of residential systems in North America. And you can see that it's less than 20%, about 18% of the time. So over 80% of the time, you can have the best filter in the world installed in your house, and air is not going through it unless you do something to make air go through it. So I always have liked this cartoon that's in the lower left. It's about kind of a lazy beaver who gets a day planner to help him use his time more efficiently. And, you know, his complaint is that, you know, the day planner just sits there. It's not actually planning his day. And that's exactly true of a filter too. You can have the best filter in the world, but you've got to make air go through it for it to make a difference. If we move to the filter or the air cleaner itself, then there's this question of efficiency. And I think there are 2 kind of very big misconceptions about filters. The first one is most people think small particles are hard to filter, and the smaller they are, the harder it gets. In fact, most filters have a U-shaped efficiency curve. And so the efficiency is higher for both smaller and for particles. And that's because there are different mechanisms that affect those particles. So that U-shaped is very important and has a lot to do with how filters perform. But the other important thing is people don't quite understand how filters are tested. And so the table here is from ASHRAE standard 52.2, which is one of the most common filtration standards. And you might have heard of the MERV number, the MERV. That's the main data product. And so how this standard works is you take a filter in a laboratory test duct and you challenge it with particles, and its efficiency is rated in 3 size bins, ranging from 0.3 to 10 microns. And depending on how it performs in that lab test, it gets a MERV associated with it. So that's how MERV works. But that's in a laboratory. When you go into real buildings, you see something very different. So these are data from 20 homes. This is a brand new MERV 14 filter, exact same filter installed in each of these 20 homes. And the black line that you can barely see is the filtration performance according to ASHRAE standard 52.2 test, the laboratory test of this filter. The individual symbols are each associated with the actual installed performance in each of these homes, again, when the filter was brand new. And you can see that some of these homes, the filter performs quite well, quite similar to the ASHRAE, but a lot of them are lower and some of them are substantially lower efficiency. And so this whole issue is you can't necessarily take a lab efficiency number and assume you're going to get that performance in a real building. And you might ask, why is there this performance degradation? And the short answer is one of the main things is there's bypass. So if you look at filter racks, this is in a large institutional building. This is what the filter rack looks like from far away. If you get close, the filter is held in with little tabs and there's gaps around the filter. And so some of the air goes through those gaps instead of through the filter. And the better the filter, the more air is pushed through those gaps. And sometimes you see, this is a a filter rack in a large commercial building. You can see that in some cases the filter kind of pulls away from the rack and you get huge amount of air going around the filter rather than through it. So making sure that we're gasketing filters is critical to their performance. There's another issue that is less well understood, but very well demonstrated, that a lot of filters are made to have enhanced removal because they have an electric charge at the factory. If you look at this filter, this is from a commercial building in Finland. The gray squares are the filter performance when it was new, up at the top. And then over time, and this filter was rated for a year of use, although the testing only went for 9 months, you can see that it degraded, pretty substantially after a week, really substantially after a month, and then further on down from there. So even though this was a very good filter when it was new, it performed much less well as it aged. And this is kind of an open secret, well known, that filters don't necessarily perform as well as they age as when they were new. And then the last issue with filters is this concept of how does the filter fit into the overall building? This is, again, some data from residential buildings, about 16 different studies, all that study different efficiency of filters. And what's on the y-axis here is something called effectiveness, how effective the filter is at reducing concentration. And you can see that it's basically a cloud of data. There's not very much structure to it. So in some cases, a high efficiency filter performs well. In some cases, a high efficiency filter performs poorly. And so you can't just take a high efficiency filter and assume that you're going to get good performance. Now, I've talked a lot about filtration. What about other air cleaning technologies? There's a lot of other air cleaning technologies out there, photocatalytic oxidation, plasma, bipolar and unipolar ionization. the short answer about these devices is, in the red boxes. The first one from Dr. Pettenkofer, who's kind of the great-grandfather of the modern study of indoor air, is, kind of be careful. And there really is a buyer beware situation going on here. First of all, I would say that these terms like plasma don't really have a firm definition. They're used differently by different manufacturers. Second comment is that almost always, in fact, maybe even always, there isn't an independent evidence. And I mean, solid science demonstrating that these devices will be effective. And then the third issue is that there can be evidence of harm from the use of some of these technologies. A big one is some of them emit ozone as a byproduct of their operation. There's been some recent evidence of potential harms from ions being emitted from these devices, as well as issues associated with other byproducts being formed. And so really, I suggest do your homework and be cautious with these technologies. So one technology I haven't mentioned that does have some evidence behind it is ultraviolet light. Ultraviolet light has been used for a long time. The basic principle is very well established that for many microorganisms, short-wave UV light breaks down the microorganism. And there are 4 common ways that we use UV in buildings. One is to irradiate coils to stop microbiological growth. And another way is in portable air cleaners. I would suggest that those do not yet have any evidence that they can be effective for SARS-CoV-2 or for reducing COVID-19 transmission, simply because there isn't enough of a UV dose delivered. At least that has not yet been demonstrated. But there are two approaches that do work: upper room systems and in-duct UV systems. And there's a lot of kind of literature on how to do them well. The short form of that is you really have to manage airflow. You have to make sure that the microorganisms get enough a dose of the UV light. There's pretty substantial maintenance requirements, making sure those bulbs are clean, and putting out appropriate doses of the UV lamps, of UV light. And then also, there is a danger, especially with cheaper bulbs, of ozone emission if the wavelength gets small enough. And so UV is certainly an option, but it has to be done well. I'm getting towards the end here. I want to make 2 points that didn't fit elsewhere in the presentation. One is that if you tried to buy high efficiency filters or other air cleaning devices, you've probably bumped up against a procurement issue. And what that has meant is a few things. One is that there's a lot of kind of less than ideal products coming in to fill the gap. And so you really have to be more careful than ever. And then the other thing that I always like to say to people is I would much rather people use a low efficiency filter well, meaning well gasketed, well maintained, than use a high efficiency filter poorly. And so if you are facing procurement problems, you can do things with lower efficiency filters, just use them well until the supply problems get better. And by the way, some of that supply problem is caused by an interaction between the PPE supply, some of the same constituents, and filter supply. Then the other thing I always like to mention is from an occupational standpoint, changing filters, I mean, it always has to be done frequently enough so that you're getting the benefit of the filter, but it also has to be done carefully. And so make sure that you're protecting the personnel who are changing filters, because it's not clear how much of an infectious disease risk, but we certainly know that there can be microorganisms that are active on filters. So if I were to summarize everything here, install a good filter, use it well, make sure lots of air goes through it, change it frequently, don't use your filter as the only approach, and avoid any of the alternative technologies until you have, or unless you have, independent confirmation that they actually work. I'll be glad to take any questions.
Thank you very much, Professor Siegel. And a question, if I can just ask you, And I did note recently in the media, there was mention of the air purifiers only being effective close to the source. And that was, I remember reading that was one of the reasons why the air purifiers weren't being recommended. So, you know, to me, that kind of would defeat the purpose, so to speak, because especially in a classroom with a lot of students, there's lots of sources. I'm just wondering if you want to comment on that.
Sure. And I think there has been a lot of misconceptions in the media. So certainly, absolutely, an air purifier is going to work better if it's either near the source or near the receptor that you're trying to protect. But I would comment that, you know, just like with everything else I talked about, air purifiers can be used well and they can be used poorly. So using them well means, first of all, making sure they're sized appropriately for the space. So that they're actually affecting the concentration of the virus in the air. And number two is, you know, addressing issues of mixing and distribution. And that's kind of a room-specific decision, but it's certainly very doable. And in fact, air purifiers, good HEPA filters, are, I think, a very easy solution for a lot of spaces because, you know, frankly, HVAC type retrofits are often quite expensive, sometimes entangled with other issues like asbestos remediation or very high cost items. And so, you know, I think we should all be using more air purifiers, particularly in high risk settings. Again, they're not magic, but they can help kind of take the edge off the risk.
That's great. Do you have time for one short question?
Sure, by all means.
Okay, and I know this will get asked a lot. So thinking about the layers of cheese model that you presented, it says if you have sufficient ventilation or proven air purification indoors, will you still need to wear a mask in a restaurant bar setting?
So short answer is yes, you will still need to wear a mask. A little bit longer answer is, you know, remember that for a filter or any ventilation strategy to work for close contact, you really need just massive amounts of airflow because you have to stop the virus from, you know, going from an infected individual to a susceptible individual in a very close distance. And that's a very hard job. And so I always think of filters as supplement to all the other measures. But the other side of it is right now we're talking about the pandemic, obviously, but I really hope that we start to look at filters as a good general strategy and we pay a lot more attention to them because in the long run, you know, in a restaurant, once we're past the pandemic, we can have a lot better health of the customers and of the staff if we address indoor air quality. So short answer is yes, we still got to wear a mask, but there's a lot of benefits to filtration.
Great. Thank you very much for your time. And on behalf of OCAM and everyone on the call here on the webinar, we appreciate your time. Thank you.
Thank you.